Hey everyone, got a special guest today, and he is the CEO and the founder of a company called Keto Mojo, and that's one of my favorite units. I use it, I promote it. It's one of the better ones because it has several things, and that's why I wanted to bring you on to kind of explain to everyone what is it, why is it different, and what can you do that is different than other meters. But when you're doing keto or intermittent fasting, it's really, really important to know where you're at, and also do testing, especially in relationship to eating, intermittent fasting. The worst thing is like, wow, it's not working. Am I in ketosis? Am I not in ketosis? And the other thing is when you actually do the urine strips, people have a confusion about this, like what's the difference between a urine strip and actually a blood test? You know, at first, you may show ketones in the urine, but as soon as you become more efficient and you adapt, you're going to want to get a unit that's a blood test so you can actually have it more accurate. So why don't we just go ahead and address that point, and then I have a series of questions that I want to ask you.
Yeah, thank you, Dr. Berg, for inviting me on. So, we have a phrase here at Keto Mojo that measurement is the first step that leads to control. And once you can control something, you can improve upon it. So there are three types of ketones. You've got acetoacetate, acetone, and beta hydroxybutyrate. So the acetoacetate is what is spilled into the urine when as you just mentioned, when you are first starting. And it's very kind of like subjective, like what shade of pink do I have? And realize that you're only measuring what was spilled over a period of time since you last urinated. And hydration can have effects on that. So if somebody's dehydrated, they're going to look like, wow, I'm really deep and purpley, I must be great. But no, you might actually just be a little bit dehydrated. So acetone represents about 30% of the energy that's available to the body, and then it's very volatile chemical that quickly gets shunted into beta hydroxybutyrate, which is far more stable compound. And that's what we measure in blood, and that represents about 70% of the energy that is available to the body. And so that's why in all clinical trials and all studies, they measure blood, because the blood has a quantitative analysis and it matches to an international standard that is laid down for it. The last method of testing is acetone, which is done in the breath. And we've seen the rise of different breath analyzers, and that the challenge with those is most people don't know that unless the sensor is replaceable in that, if you've had any sugar alcohols in the last 60 minutes or chewing gum or alcohol itself and a variety of other things, you can actually blow out that sensor, because what you're basically doing is coating the sensor with all the sugar alcohols that are on your breath, not allowing the acetone to come on in. And those breath sensors were originally done actually as breathalyzers for alcohol, which is a much bigger, if you will, molecule. And that's the problem with those. So you can end up having just an expensive paperweight really on your desk. So all studies, all doctors, all clinicians, blood is definitely the way to go. But with our meter, we do blood as well. In the blood, we measure not only the ketones, but the glucose as well. There's two strips to do that.
Yeah, that's one of the things that when people get a meter, they do I get the blood? Do I get the ketone? Well, this one actually does both, which is really cool. Now you do need two different types of strips. So
yeah, and using two strips, if you're only measuring one part, you're only seeing half the picture. And you can actually, first of all, the basic part is like, how close am I getting to ketosis? So measuring your ketones for that, you see yourself gently rising up once you get to the threshold of 0.5 millimoles. That's the threshold of nutritional ketosis. Between 0.5 and roughly 3 is sort of like the optimal zone. Higher is not necessarily better. Don't go chasing ketones out there. You've got to work out what your bio-individuality is. And to do that, it's sort of like get to learn what your baseline is. So first you get the joy of the gamification, if you will, like how close am I getting to ketosis? If you're not getting there, what's going on in your diet and what you are doing to help you that's preventing you? And that's where glucose can come on in. And I like to call it sleuthing out your trigger foods. So Glucose moves really quickly in the body. You know, if you have ice cream or carbohydrates, that very quickly within 60 minutes is going to be converted into glucose, and then your body has to have an insulin response to that to manage it. Otherwise, you get diabetes. So you will see your glucose spike on up really quickly if you've had a food that contains glucose on it. And then that can tell you, hey, maybe I should avoid that. Generally keep the swings under 30 milligrams per deciliter for Americans, or that's roughly 1.7 for Europeans, millimoles in glucose. You want to keep those rises very kind of like small. So that's trick number one you can do with a glucose strip.
And one point about that, like the higher the glucose reading, the less ketones you're going to actually have, because the body's going to be running on that glucose and not the ketones.
Bingo. It will preferentially say, hey, I've got to use the glucose and manage that, which means it won't produce any more ketones. And then you'll slowly see your ketones drift down. Ketones move very, very slowly. You've got to think of them like a slow moving tortoise and the hare thing in that respect. So the second thing you can do is, personally, I have an issue with sugar alcohols, sorbitol, erythritol, xylitols, any of the tols. What I find is I might not get that glycemic spike, but what I do find is that my ketones start to drift down. And what that tells me is I may not have been having a glycemic response, glucose going up, but I have had an insulin response to those sugar alcohols. And this is one of the things that really comes into play. Just because it says keto on the label doesn't mean it's keto for you. Everybody's a little bit different in that respect. And that's why we like to approach things about bio-individuality. You know, one size does not fit all, and you kind of like need to work out what right is for you and your body. Some people have an issue with dairy too.
Now, this is interesting. So you have two things. You have glucose and you have insulin. People have this idea that, well, glucose is the only thing that will stimulate insulin. There's actually non-glucose things that can stimulate insulin. Even protein can do it. So, and especially low-fat protein, like even whey protein. So if the insulin goes up, but your glucose doesn't go up, that's going to knock you out of ketosis as well. So this is a great tool to be able to identify what foods you can't eat on your program. And even with the keto so-called friendly foods, you have people using maltodextrin, dextrose, what else do they use? They use tapioca starch, like these corn starch. Yes.
Yeah. All of those fiber fillers can have an effect on some people, but not on others.
Not everyone. No.
Yeah, I mean, if you can get away with it, like, all power to you. You know, I mean, I've tasted a lot of the conferences, some of these keto foods, and like, I'm like, that's so delicious. But the things I would probably eat an entire plate, because that's what triggers me. And so I'm like, I personally steer clear from those and do, but you know, the highest of desserts for me is strawberries and cream. So I'm kind of happy with that.
Hey, that's great. I can do the sugar alcohols. I like xylitol. I even like allulose, but I don't do well with erythritol for some reason. So it's just one thing that I've discovered.
Yeah, monk fruits are kind of a go-to one for me that works out really, really well. But yeah, but we all have our own ways. So when you are able to test with glucose and ketones, this sleuthing aspect is a really useful tool, especially when you're first starting out. But as you say, you've got to get that baseline first to learn what is your right, because you can certainly say people run at different levels on their glucose. And so normally what I say to people is find your baseline, and that's about an hour after waking. Because when you first wake up, you've got that dawn phenomenon, which basically gives you that cortisol spike in the morning. So when you get a cortisol spike, that will actually increase your glucose. So this can happen.
Just to clarify, people that don't know what the dawn phenomena is, when you check your blood sugars, they should be low if you're fasting, but in the morning, sometimes they're high. Like you're going, wait a second, I didn't eat anything. I got high blood sugar in the morning. That's because the adrenal hormone can produce cortisol and release it, mobilize it. And so all of a sudden your sugar goes high. It's not that you ate sugar.
Precisely, yeah. And so that's the challenge with that part there. And now most people think, well, I see a lot of literature that states dawn phenomenon is about an hour, but on some people we've seen that roll for a lot longer, and so that's why it's sort of like, hey, you got to work out what is right for you, and that's what I call the curiosity testing to find out your bio individuality. So so you got your baseline there. So then a lot of people ask, well, when should I test?
Mhm.
Well, when to test, if I like to do that in the morning, just before breakfast, so I get my baseline. And your ketones are generally lowest in the morning, and then they rise up during the day if you've been eating nice and clean. And they get to their zenith just before your evening meal. So I like to do like a low and high just to find out how I'm doing. The second time is when we're sleuthing out foods. I would then do about 60 minutes after eating, and I do a double test on that to see what's going on with that particular meal. Now, do you have to test after every meal? No. Who wants to be a slave to the meter? I mean, I certainly don't. But you want to work out what is right for you. So we find a lot of people test a lot to begin with. Work out, they test, they adjust their diet. Work out, they test, they adjust the diet. Until they get to the point and they test, they're in ketosis. They test, they keep their glycemic response low. And if that happens repeatedly and you're a creature of habit, you don't need to test because now you've learned it. You know you and your body. And then from then you can move on. So I think Keto Mojo is the training wheels in life. You're not going to stay with them all the time. And eventually you're going to be shooting on and you'll be doing great and you're going to be healthy. And it's like, hey, yeah, job done. That's what we started, what we got into this for, is to try and revolutionize the cost.
Yeah, I always use that when someone's having trouble, and also when they're like, oh, I'm stuck. Okay, so are you checking your ketones? Well, no. Are you checking your blood sugars? No. Okay, I need that data to evaluate. There's two things that I wanted to mention. One is, let's say, for example, you have coffee in the morning and you have MCT oil. You're having fat, right? Which turns into ketones. So you also have eating a meal. Let's say, for example, you're eating more carbs in that meal versus really low carbs, more fat. Your body will turn some of that fat into ketones, and you could be in a situation where your ketones are high, but you may not lose weight because you're burning up your dietary ketones, your dietary fat, and that's like a big thing that people get frustrated sometimes. So if you're really in the ketosis and you get your blood sugar down, okay, good, that's to the side, but you're still not losing weight. Well, maybe you need to adjust your dietary fats.
Absolutely. And there's the whole sort of like macro thing that comes on into play there. When I first started, yeah, I did track my macros. I calculated my BMI and all of that stuff with a macro calculator. And then every month after that, I did a recalculation as my weight dropped, because it's going to change over time. And also your satiety changes as well. And I kept myself in a slight caloric deficit only by about maybe 5%, 10%, something like that. Because I knew that then I would be metabolizing my my bodily fat. And so, yeah, so there's a misconception when people say that a ketogenic diet is a high fat diet, moderate amount of protein, lots of above ground leaf and vegetables. It really is an adequate amount of fat for you and for
Right.
your journey and what you're looking to do. Because remember that there are people who are looking for a ketogenic lifestyle for weight loss. Then there are those that are using it maybe for traumatic brain injury or for epilepsy, or because they're using it for psychological reasons as well. I mean, I used to be on antidepressant meds for many, many years. But I found that when my ketones are between 1.1 and 1.7, now this is me personally, everybody is different, that when I was between 1.1 and 1.7, this was my sweet spot. And I was able to come off all of my antidepressant meds. And so when you look at the use of MCTs, which is, I like to have capric acid C8. It's really bioavailable to the liver and can make you a nice pop of endogenous ketones really, really quickly. And so for me, if I'm looking to get into my optimal zone for a reason, I'll just have a little bit of MCT oil in my keto coffee in the morning.
So I want to just give people a really cool tip about this, about MCT oil in general. Um, there's something unique about the brain. The brain does love ketones, um, but when you're trying to get into ketosis, um, sometimes it takes some time, especially if you're like have insulin resistance or you're pre-diabetic or diabetic, and your body is just making more sugar and you just can't seem to get the sugar down. Um, one thing you can do is take some MCT oil, a little bit more than usual, to spike your ketones. Now, what's going to happen, your brain will choose the ketones more than the glucose. It'll actually, as a preference fuel, it'll pull the ketones up the brain and use that. And usually, if you have a problem with insulin resistance, you're going to have insulin resistance in the blood-brain barrier, and those ketones will bypass all that. It'll feed the brain cells, and you'll start feeling better right away, cognitive and your mood, because your brain is starting to get the fuel that it needs. So it's a little hack. It's very powerful and something you could speed things up as you're trying to get into ketosis. You can actually you could take ketones too, ketone salts if you want. The only time I recommend that is if you're like an athlete or maybe you have some type of Alzheimer's, Parkinson's, or dementia that you want to just give some straight fuel to that brain. It'll suck it up in preference to glucose. So that's cool.
Yeah, I mean, and so the exogenous ketones, they can be quite expensive depending on your pocketbook. And, I will see at one packet might get about a millimole to a 1.5 millimole rise for about an hour and a half.
Right.
Whereas MCT will, for what is 32 cents retail, can, if you are already fat adapted, can give you over a millimole rise and last for a lot longer, 4 or 5 hours from that, because your liver is making it endogenously. But also don't go crazy on MCT oil, because I've seen people do that. I've actually done it, and it's not pleasant.
Yeah, right.
So
go light.
Look at what your tolerance is.
Go light. If you're also, one thing with the Keto Mojo device is really good to use if you're pre-diabetic or diabetic, to see your improvements pre and post meal by several hours. So if you start looking at the dynamic fluctuations of what happens to your blood sugars and your ketones before and after meals, like say 1 hour after, 2-3 hours, you can start tracking the trends, and you're going to see like, wow, I'm getting better. Wow, it's a great tool to measure improvement. And so evaluation is about comparing two things, okay, before and after keto. So highly,
Our meter, by the way, has the ability to actually tag AC and PC. So pre and post, basically your meal. So there's a little Apple icon that is on that. So you can do a little tag just to remind you, hey, what was going on that one there. And we all obviously have our Bluetooth connector that now you can connect all of that data, and you can share it, put it onto your phone, and then put it onto other platforms as well. And we've got some exciting news that's going to be happening on that front very soon too.
Very nice. What's the exciting news?
So we've been working for the last 6 months to build a secure, HIPAA-compliant, encrypted health cloud. And in that health cloud, you're going to actually be able to track all of your data. And then what we're also going to be working now, once we have built this health cloud, we'll be able to do simple API calls, as the tech boys say it. And that means we're going to start interlinking to all different electronic health records and other systems as well. So basically, we want people to have access to the data, but they also need to share it with their caregiving team. So say, for instance, you've had a cancer diagnosis, and you're using a ketogenic therapy as an adjunct to your normal standard of care, you're going to want to have your integrative medicine doctor, you might want to have your chiropractor, you might want to have your oncologist, your radiologist, and maybe even your health coach have access to all of that data at the same time. So one of the challenges of going keto is self-accountability. It's a psychological and a physiological game that gets played here, and you have to change somebody's lifestyle habits And that takes 30 to 60 days to really ingrain that habit. And that accountability, so you don't fall off the wagon during the time, is where glucose and ketone measurements can come on in. Because then on a daily basis, you wake up in the morning, you test, you know in your state of ketosis, great. That means what you were doing last night was right. Then if you're using the GKI, because you want to have a very low ratio for maybe for a cancer therapy, according to Professor Thomas Seyfried.
Right, you want to define what that means?
Yeah, that's a good question. Glucose ketone index is the GKI, and it is the relationship between your glucose measurement in millimoles and your ketone measurement. So in America, you will take your glucose measurement, which is in milligrams per deciliter, and you divide that by 18, and that will give you millimoles. And then you then divide that by your ketone measurement. So nutritional ketosis is defined anywhere under 9. So a nutritional ketosis kind of GKI will be somewhere anywhere from maybe 3, 4 to 9, that top end. Then a therapeutic ketosis, maybe you're using this for epilepsy or for PCOS or something like that. That's going to be roughly 1 to 3. Cancer, you're going to try and get it under 1, but that is really, really, really hard. Usually you need to be, you will definitely need to be under doctor supervision for that. You'll definitely be doing a caloric restriction, 1 meal a day. You might even be on metformin as well and some other stuff to really get that glucose down low, because the Warburg effect is what comes into play here. That
I want to touch on that one point just so people have a little reality on this this cancer thing. Dr. Thomas Seyfried, who is he's doing research in Boston, fascinating book. It's called Cancer as a Metabolic Disease. But what he's done, he can't find, now he's doing it in animal studies, but you can't find a type of a cancer that can survive after 15 days of his protocols. So he's basically, the thing about cancer cells is they're hyper glucose consumers. They consume glucose at a rate, I think if I'm not mistaken, it's like a 33 times more than normal cells. So you have to starve them. And then if you starve them, they can't live. So to do that, you want these tools to measure your blood sugars. You want to get it really low. Metformin probably would help. But you know, of all the drugs, I think that one probably is, if you take the B vitamins or B1 especially, probably the least amount of side effects. Or else if you don't, it could create a big side effect because it has a warning label on there for lactic acidosis. But B1 is what you would need to prevent that problem. But yeah, so it's about dropping the glucose so you can actually attack this cancer and then have the cells, the good cells, live on ketones. So it's a great strategy. There's videos on this data, but go ahead.
There's also a recent paper that Thomas Seyfried just recently posted up, along with Dominic D'Agostino, Miriam Kalamian, and Arlene Deer, all about their press pulse approach and protocol. So I encourage people to read that, because it goes a little bit more into detail about how they did lower the glucose there, and how they were using hyperbaric oxygen therapy at the same time, because the cancer ferments the glucose in the cell anaerobically. So they wanted to make it a very aerobic environment. So they're trying to make it as hard as possible for that cancer to survive, until eventually it's weakened down so much that the body's wonderful immune system can really get into play and get its arms around it and necrotize that tumor. And
I was just going to say that since you brought the topic up on cancer, that's one thing I'm going to be talking about at the summit. You're going to be at the summit. You're going to be testing people. A lot of people that are watching now are going to be there. It's going to be a great event. But I'm going to be touching on some interesting data with cancer, because here's the thing with the cancer. There's this conventional viewpoint where you have a genetic mutation and then you get cancer. but it doesn't really pan out. There's too many holes in that theory. And also all the different chemotherapy drugs have not really panned out to wipe out cancer
Yeah.
because there's too many mutations there. It's all over the place. Well, see,
So,
go
to
ahead.
Dr. Berg, just to your point there, I mean, if you look at the rise of the cancer rate since the 1970s, in direct correlation to the rise of cheap carbohydrates being consumed and the obesity rates, you know, has our genetic code changed so remarkably since the 1970s? No way. No, and it's not. So it's not like that. So I really think that that's a bit of a fool's errand that some of the doctors are going down on that fact, that saying it's a genetic thing. Yeah, that can kind of like tip the scales a little bit, but not to the extent that we've been seeing at all.
You have genes that are passed on from your parents that potentially could be cancer genes, but it's a very small percentage. The great majority of genes are affected by our environment. I'm sorry, the great majority of cancer is affected by our environment, which means that it's something else. And so Seafried talks about this. Warburg actually started it, the whole concept, but he said at first there is a shift of metabolic in your mitochondria, the metabolism starts fermenting glucose. And then after that, you start getting mutations, which is fascinating. So it's like, what? This is a whole new concept. So what I'm going to be talking about is exactly what you said, but the nutritional deficiencies that are the perfect storm, because there's 8 nutrients that are really important in repair and chromosome stability and preventing breaks in the DNA and also the cellular machinery with mitochondria. And if you're deficient in, I'm not talking like fully deficient like you would be in scurvy, but if you're deficient just like subclinically, that alone could create the same damage as radiation therapy, which is like mind-blowing. You mean a nutritional deficiency could be just like getting radiated? I mean, this is like huge. So anyway, I'm going to talk about that at the summit, which is fascinating data, and I just wanted to mention that.
Yeah, I'm really looking forward to the summit. Last year, it was absolutely fantastic. It was super well attended. The quality of the speakers is excellent, and so we're really honored to be invited back again for that. So thank you Jeff, for that.
Yeah, I think you also noticed that people that were tested, there was more people in ketosis than other conventions or symposiums you've been to, right?
Oh, totally. It's funny. I was at a convention in England. I'm not going to say what it was, but it was full of doctors and nurses, and I tested them, and no one was in a state of nutritional ketosis. And I asked the group, like, has anybody actually practiced this or lived it? And they were using it as therapies for the epileptic community. And they go, oh, I don't need to do it because, well, maybe in 20 years. And I'm thinking like, oh my God, the damage that you're doing. But this is the way that I love the work that you're doing and others in the community, is by sharing the information, we can put it out there. And this is what I call about weaponizing the consumer. We need to give as much information as possible to the consumer so they can make judged choices of what they need to do. But I'd like to come back to what you said about radiation therapy there a little bit. My wife was diagnosed with breast cancer. She's now 7 years clear, which is fantastic for that. But we wish we had known then what we know now, because it would have been a massive game changer, I think, in her recovery time. And whether or not we would have gone for the standard of care there would have been something really up for a much more heated debate than what it was, because the effects of the radiation therapy can be pretty harsh to the body. And I think when you talk about nutrient density and making sure that we have all of that good rich to give our bodies what it needs is vitally important. That's what I'm going to talk about in the ketogenic community, that's nutrient density. But I also want to touch a little bit on that ketones is not just energy. It has a signaling effect within the body. And when we talk about cancers and the rise of cancers, is it can up-regulate gene expression and down-regulate other gene expression. And just as the converse glucose can do that. So if you were predisposed to have a cancer and now you've got a large amount of glucose with the body, you can be up-regulating those genes that you don't want to be doing that, allowing for that that room for that to come on into play. And I think the work that's going to be done on the signaling aspects of ketones is going to be really exciting, especially in the neurological world coming up in the future.
I love it. I love it. Well, this has been really good. Is there any last points that you wanted to mention? Anything new or anything?
Well, I think the next 60 days of Keto Mojo are going to be probably the most exciting 60 days since we first launched. We have a brand new website that is coming on out, and that's what we talk about, the weaponizing of the consumer with recipes, how to, information, what's going on in the keto community, clinical trials, papers. It's something that the team have been working on for the last 5 months, and we're super excited with that. That will be also paired with the new dashboard in which you can track your health data, because that measurement will lead to control. And then there's something very exciting coming for Europe. Can't give you the date yet, but that will be coming up in a little while. But it'll be pretty exciting. We haven't forgotten about our European friends.
Well, there's going to be a lot of people from Europe watching this, so I'm sure they'll want to. I'll put the link down below, guys, for what he's talking about, so you can check it out. But anyway, thank you so much for taking the time out. I think we got a lot of great data out there, and I appreciate everyone watching this, and stay tuned for more updates.
Absolutely. Cheers.